Hello, I'm Dr. Nagaraj B Puttaswamy. What is appendicitis? What are the warning signs? How a patient can be, managed without surgical procedures? Should we do, laparoscopic surgery or open surgery? Or is there a, complicated scenario? The appendix perforates or ruptures. These are common things which we come across. Appendix is an organ which is located at terminal part of small intestine and the beginning of large intestine. And that is a junction that is around the ileocecal junction. The appendix would be there. What is the function of the appendix? It doesn't have a major intestinal or a digestive function to perform. We call that as a vestigial organ, an organ which is there as an accessory which has not much of important function to perform. Then we should be asking, then why did God create that organ? See, it has been evolved as a development process, but it has got sidelined. But in animals which are not very established as a human, definitely this organ still has digestive function, some storage like activity. But humans doesn't have important functions which the appendix has to perform. But unfortunately, it is rich with lymphoid follicles or something like, they are the cells which will attract infections. Say for example, in the oral cavity or in the throat, there are tonsils. They are rich in lymphoid follicles. Say, God is special creator. The oral cavity is the entry of the digestive system. If there is a possibility of infection or infective food which we are consuming, the infection has to be filtered. So God has created significant amount of lymphoid follicle system around in the oral cavity. Multiple, even in the retropharyngeal space, around the oral cavity, there is a lot of lymphoid system. But tonsil is highly concentrated, so easily gets infected. Many a times we see patients having tonsillitis when they eat contaminated food or drink contaminated water. Same way the patient develops sore throat. Similarly, in the abdomen, appendix is called the tonsil of the abdominal cavity. So it will easily attract infection if there is any sort of infection in the intestinal system. So any infection in the appendix is called appendicitis. Common symptoms of appendicitis are, say, pain abdomen, vomiting and fever. These are called cardinal symptoms of appendicitis. A sign of appendicitis is tenderness or pain after examining in the right lower abdomen, that we call as a right iliac fossa, and rebound tenderness following examination. That is, immediately after you remove the hand, the abdominal cavity get relaxed and then pain is way more severe because of the peritoneal irritation. That is called as rebound tenderness. These are called signs and symptoms. So generally, the patient would had something which is contaminated and there is some amount of intestinal infection the previous day. Early in the morning, the next day, the patient develops vague abdominal pain in the upper abdomen. Slowly, the pain migrates to the umbilical region and finally settles in the right lower abdomen, that is the right iliac fossa, by afternoon. Patient would have been okay. Maybe most of the times the sufferers are young people, maybe teenage people, maybe children, because the infection possibility is relatively high there. See, neonates or very small children, do they not be affected? They will also get affected. Seniors and elder patients, even they can get affected. But commonly, appendicitis is seen around the teenage group. So once the patient develops that symptom of pain, abdomen, vomiting, the patient will start gradually developing fever with some amount of chills. These are three important symptoms. Many a times the diagnosis is done clinically. Once an experienced doctor tries to seize the patient, he will examine the patient. Patient has fever, patient has tenderness in right iliac fossa, and along with rebound tenderness, this will tell that a typical appendicitis diagnosis. The patient can be subjected for a basic ultrasound to confirm. Many a times a high resolution ultrasound can invariably pick up appendicitis, and the basic blood investigations what we try and do is usually we call a total count raise. So generally it should be between 4 to 11,000. The total count will be raised between 15, 20 depending on the amount of infective status. So it will make a diagnosis. Once the diagnosis is done, how early should we do the surgical procedure, or can we really treat the patient of appendicitis medically? Is two dilemmatic questions what we usually get into. Many times if there is a condition called a catarrhal appendix, catarrhal is something like, catarrhal disease is something like an early symptom of, say, viral infection. If I have cold, should we treat that very aggressively or should we keep quiet? Many a times even if you keep quiet, the catarrhal cold will invariably be fine with. Similarly, a catarrhal appendicitis, if it is found early, we can treat that medically. Yes, of course. We can treat the patient with antibiotics, analgesics, and at the same time we can allow the patient not to eat much, so that the infection or appendix doesn't suffer physical challenges when the intestine is functioning aggressively to propel the food further down. So if this is done, many a times a catarrhal appendix or early appendicitis can be still treated medically. So if the patient has gone beyond that stage and it has to be operated, how it should be done, whether it can be done laparoscopically or by open surgery. So end of the day, we have to remove the appendix, whether we do it laparoscopically or conventionally. The conventional surgery is very easy and convenient. It is time tested. It has given a wonderful result. But only thing is we have to make a cut. We make a cut in the lower abdomen on the right side and then identify the appendix, remove the appendix and close the abdominal wall. What does it do? It will leave a possibility of post-operative pain, discomfort, possibility of infection, all that. But following laparoscopic surgery, it is very, very convenient. We make 2 or 3 port sites, 5 mm of each. So port insertion will be done. Camera will be introduced into the abdominal cavity. We can visualize the whole of the abdominal cavity, identify the amount of pus or contamination the appendix has caused in the abdominal cavity, whether it is restricted only in the right iliac fossa or there is spillage of infective material into the pelvic cavity or even into the paracolic gutter. So all this can be easily identified laparoscopically. We can do appendicectomy technique. We try and do ligate the base of the appendix, remove the appendix, put it in the bag, endo bag, and try to retrieve to one of the port sites. And fantastic part is we can do a thorough lavage. We can do local lavage, we can do a general peritoneal lavage. All this can be done better with laparoscopic surgery. That is what my thing is. See, if the appendix is not attended, appendicitis is not attended timely, and if it perforates, what would be the complicated scenario? See, you just understand appendix which is infected contains significant amount of infective material, particularly pus. If it perforates and it spills into the abdominal cavity, that is a condition called peritonitis. A perforated appendix can cause peritonitis, which is life-threatening for an individual. We don't allow or we don't want the patient to be going to that level and have a complicated scenario on our hand, so that it is becoming that much serious for the patient to go through and also that much difficult for the operating surgeon and the physician to manage that patient. And invariably that will prolong the care in the hospital for the patient, intra-op and also post-operative period. So a perforated appendix is much challenging when compared to a relatively simple conventional appendicitis, which we can generally do. Now, confidently tell, laparoscopic appendicectomy is a time-tested and a proven surgical procedure which is very ideal for any sort of appendicitis, and recovery period is very quick. The patient can perform normal activities maybe in a couple of days following laparoscopic appendicectomy.